1. When designing an advanced emergency medical care assistance training program, which instructional strategy best supports adult learners who bring prior field experience? A. Lecture-only delivery with minimal interaction. B. Problem-based learning using real-life emergency scenarios. C. Rote memorization of emergency care protocols. D. Instructor-led demonstration without participant feedback. 2. In evaluating learners during an advanced trauma module, which method most accurately measures their competency? A. Written multiple-choice exam only. B. Peer evaluation during classroom discussions. C. Objective structured clinical examination, OSCE with simulated patients. D. Self-assessment surveys after the lesson. 3. Which principle of adult learning should be prioritized when teaching airway management to experienced EMTs? A. Providing information without context. E. Emphasizing passive observation of instructor skills. C. Connecting new skills to learners' previous emergency responses. D. Focusing only on national statistics. Or, during a mass casualty simulation, which evaluation technique ensures fair assessment of both individual and team performance? A. Group self-reflection without scoring. B. Standardized rubrics applied by multiple instructors. C. Random verbal questioning during drills. D. Instructors' subjective impressions. 5. When aligning a curriculum for advanced emergency care, which element ensures regulatory compliance with national EMS standards? Including a section on stress management. B. Adhering to established scope of practice guidelines. C. Adding extra modules on unrelated health topics. D. Allowing flexibility without standardization. 6. Which mentoring technique most effectively enhances the confidence of a new emergency medical assistant learning advanced cardiac care? A. Assigning them only written case studies. B. Providing constructive feedback during real-time practice. C. Allowing them to work independently without guidance. D. Limiting opportunities for error by restricting tasks. 7. In designing evaluation methods for intravenous IV therapy skills, which approach best measures psychomotor competence? A. True-false quiz questions. B. Observation of task completion using a checklist. C. Group brainstorming on IV techniques. D. Short answer written test. 8. Which communication strategy is most effective when briefing an advanced EMS team before a high-fidelity simulation exercise? A. Using technical jargon exclusively. B. Delivering clear, concise instructions with time for clarification. Skipping explanations to maintain realism. E. Providing all details in written form only. 9. An instructor notices advanced learners disengaging during repetitive review. What principle of adult learning should guide adjustments? A. Adults prefer repetition regardless of content. B. Adults value learning that is immediately relevant and applicable. C. Adults retain best when exposed only to lecture formats. D. Adults prefer to avoid active participation. 10. In developing an advanced emergency care curriculum, which of the following ensures effective sequencing of topics? A. Placing most complex interventions at the beginning. Starting with foundational knowledge and progressively advancing. C. Randomly mixing topics for variety. D. Allowing learners to skip prerequisite modules. 11. Which mentoring approach best supports critical thinking during advanced pediatric resuscitation training? A. Asking reflective questions during skill practice. B. Providing only answer keys for protocols. C. Correcting mistakes without explanation. D. Avoiding learner-led discussions. 12. When evaluating advanced airway management, Which method offers the most objective assessment? A. Instructor's impression based on observation. B. Checklist with defined performance criteria. C. Learner's self-reported confidence. D. Peer opinion surveys. 13. A key regulatory requirement in advanced EMS education is A. Alignment with entertainment-based teaching techniques. B. Compliance with national accreditation standards. C. Omission of safety-related topics for brevity. D. Complete reliance on instructor preference. 14. To promote long-term skill retention in advanced trauma care, which instructional technique is most effective? A. Simulation-based repetitive practice. B. One-time lecture with no follow-up. C. Memorization of textbook passages. D. Video viewing without interaction. 15. When mentoring a new assistant in advanced emergency procedures, which practice best aligns with adult learning theory? A. Encouraging them to apply knowledge to real-world case scenarios. B. Limiting their input to avoid errors. C. Providing instructions without feedback opportunities. D. Correcting them only after formal assessments. 16. In a debriefing after a cardiac arrest simulation, which communication method best facilitates learner reflection? A. Closed-ended questioning. B. Open-ended guided discussion. C. Instructor monologue summarizing events. D. Avoidance of difficult topics. 17. When integrating cultural competence into an advanced EMS curriculum, the instructor ensures compliance with A. National diversity and inclusion guidelines. B. Local political opinions. C. Instructor's personal beliefs. D. Learner's convenience only. 18. Which evaluation tool best measures decision-making under pressure in advanced emergency simulations? A. Standardized written test. B. Scenario-based timed performance assessment. C. Peer discussion groups. D. Instructor's casual observation. 19. A regulatory mandate for emergency medical care assistant training programs includes A. Continuous review and updating of protocols. B. Optional adherence to outdated standards. C. Avoiding alignment with state-level guidelines. D. Ignoring accreditation requirements. 20. When teaching advanced hemorrhage control, which instructional design supports curriculum development principles? A. Integrating lecture, demonstration, and hands-on skill practice. B. Delivering lecture-only modules. C. Focusing solely on textbook diagrams. D. Providing skill practice without background knowledge. 21. Which mentoring strategy fosters independent problem-solving among advanced EMS learners? A. Assigning progressively challenging scenarios with guided feedback. B. Providing all answers before learners attempt solutions. C. Discouraging independent decision-making. D. Removing opportunities for self-reflection. 22. During advanced patient assessment training, which evaluation method ensures valid skill measurement? A. Scenario-based practical exams scored with checklists. E. Instructor's memory of learner performance. C. Learner journals without verification. D. Written tests with true-false items. 23. What is the primary purpose of incorporating adult learning principles in advanced EMS education? A. To ensure learners comply without questioning. B. To enhance engagement by linking training to real-life practice. C. To avoid active learner participation. D. To simplify content to an elementary level. 24. Which communication technique is critical when conveying updates on evolving EMS regulations? A. Using accessible language and confirming understanding. B. Overloading learners with legal terminology. C. Providing updates without explanation. D. Ignoring changes until final exams. 25. In evaluating advanced learners' ability to handle multi-system trauma, which assessment format is most effective? A. Objective structured scenario assessment. B. Short multiple choice quizzes. C. Informal verbal questioning. D. Peer reflection exercises only. 26. Which element of curriculum development ensures the course prepares learners for certification exams? A. Alignment of objectives with testing domains. B. Inclusion of unrelated healthcare topics. C. Dependence on learner-chosen content. D. Avoidance of standardized frameworks. 27. When mentoring in advanced pharmacology, which approach enhances safe practice? A. Encouraging learners to verbalize dosage calculations during simulations. B. Allowing learners to guess without correction. C. Focusing solely on memorization of drug names. D. Avoiding scenario-based applications. 28. Which instructional strategy best accommodates different learning styles in advanced EMS training? A. Combining visual aids, hands-on practice, and case discussions. E. Relying on lecture slides exclusively. C. Using only textbook reading assignments. D. Mandating one preferred learning method. 29. To ensure compliance with ethical standards in EMS education, instructors should: A. Maintain confidentiality during learner evaluations. B. Share learner performance data publicly. C. Ignore fairness in assessments. D. Adjust grades based on personal bias. 30. Which evaluation practice supports continuous improvement in advanced EMS training programs? A. Using feedback from learners and instructors to revise curriculum. B. Maintaining unchanged content regardless of outcomes. C. Relying solely on national exams for feedback. D. Avoiding post-course evaluations.